Tuesday and Wednesday.
Yeah. Hi, my name is Dixie Dabbs. I'm going to perform a head-to-toe assessment. Today's date is August 22nd, 2022 at 11:30 a.m. I have performed hand hygiene and verified my patient's identity. I'm going to scan the room. Alright. Okay. When you begin a head-to-toe assessment, you always start with assessing the skin. Assess the skin of the head, the neck, the face, the chest, the posterior chest, the abdomen, and the extremities. You're always assessing for color, bruising, temperature, texture, turgor, scarring, and for any infestation, nodules or lesions or masses or nevi. Okay, and we're going to first start with the head. We're going to look for any infestations of the hair color, hair texture. I'm going to palpate the skull for any indentations or depressions. We're going to palpate the temporal arteries for tenderness. And we're going to palpate the lymph nodes of the face and neck, starting with the preauricular, the postauricular, the occipital, the tonsillar, submandibular, submental, the anterior, the posterior, and the supraclavicular. And we're going to assess for TMJ. I need you to open and close your jaw. Alright, so there's no subluxation, crepitus, or tenderness noted there. So I'm going to ask you to, for the cranial nerve 5, which is the trigeminal nerve, I'm going to ask you to clench your jaw. Alright, so that's intact. Now, for the sensory part of that trigeminal nerve, I want you to close your eyes and tell me where I touch you.
Forehead, nose, chin, cheek.
Okay, for cranial nerve 7, which is the facial symmetry, I need you to smile, frown, pucker your lips, puff your cheeks, raise your eyebrows. Okay, cranial nerve 5 and 7 are intact. Okay, now we're going to move around to the ears. We're going to inspect the ears for positioning and for tenderness of the of the pinna and the tragus. We're going to look inside the canal for patency and look at the tympanic membrane. So we see on the right side the condyle light is at 5 and the tympanic membrane is pearly and translucent, pearly gray. And here on this left ear, see the tympanic membrane is intact and the ear canal is patent and the condyle light is at 7 o'clock. Okay, now I'm going to perform for cranial nerve 8, vestibulocochlear, for the whisper test. I'm going to include your right ear. I want you to tell me what I say.
1, 2, 3.
Alright, the other side.
ABC.
Alright, now we're going to test the Weber test for lateralization. Tell me if you hear this in one ear or in both ears.
1. Both.
Alright, okay, now we're going to test the Rhine test. Tell me when you hear the sound.
Now.
Okay.
Now.
Alright, good. So cranial nerve 8 is intact. Alright, moving along to the eyes. We're going to inspect the eyes for the lashes, the eyebrows, and the palpebral fissures. We're going to assess cranial nerve 2 for visual acuity. I need you to stand and look at that Snellen chart there and read the smallest line you can read.
GFBHJ.
Alright, covering one eye.
Oh, sorry.
Yeah, and cover the other eye, sorry.
GFDHJ. GFDHJ.
Okay, perfect. That's 20 out of 20. So cranial nerve 2 is intact, visual acuity. Now I'm going to test cranial nerve 3 for directed consent to light. So, okay. Pupils are reactive to light. Alright. Alright, so let's see. After your eyes, we're going to go ahead and assess for your nose. Checking on the nose for midline and straight on her face, and for nasal patency. I'm going to have you, which is cranial nerve 1 olfactory. I'm going to ask you to close your eyes and tell me what you smell.
Pumpkin.
Okay. Now, what you smell on this one?
Chocolate.
Okay, good. All right, now you can open your eyes. All right, so I want to palpate your frontal and maxillary sinuses for tenderness. You feel any tenderness? All right, moving along to the mouth. We're going to assess, open your mouth for me and say, ah, okay, under your tongue for me, good job. Okay, what I assessed there was her lips, her teeth, her gums, her buccal mucosa under the tongue, her salivary ducts, and her soft palate, and her tonsils, which didn't need to be graded. And also we, let me stick it and do this, there you go, all right. And so I assessed cranial nerve 9, which is glossopharyngeal, and 10, which is vagus, her ulna and uvula, excuse me, and soft palate rows with symmetrically on phonation, and cranial nerve 12, which is the for her tongue, and it was midline without fasciculations. All right, moving along to her neck, I'm going to assess for the trachea to be midline. Yes, now I'm going to assess her thyroid. Need you to swallow for me. All right, good deal. Now I'm going to assess your carotid arteries for there we go, no bruise, on this side. All right, no bruise. Now I'm going to auscultate those. All right, turn your head and hold your breath. Good deal. Other side. Breath. Good deal. All right, so now we're going to assess the chest, the anterior and the posterior chest. We're assessing the use of accessory muscles for nasal flaring, tripod positioning, retraction, tachypnea, and cyanosis. So we're going to start. I'm going to ask you to turn around so I can let them see your back here. Good deal. So we're going to start with okay, we're going to start with chest expansion. I need you to breathe out. Breathe in and breathe out. Okay, and for tactile fremitus, say 99.
99.
99.
99. 99.
99.
99.
Okay, while I'm back here, I'm going to go ahead and check for CVA tenderness. Tell me if this is tender.
No.
Okay, now I'm going to percuss the lung fields. All right, and now I'm going to listen to the lung fields. And then underneath here. Okay, now I'm going to test for egophony. So every time I touch you in the stethoscope, I want you to say E, okay? E. Okay, now every time I touch you, I'm going to assess for bronchophony. I need you to say 99.
99. 99. 99. 99. 99. 99.
Okay, we're going to assess for whisper patriloquy. So every time you feel me touch you, say whisper 1, 2, 3.
1, 2, 3.
Whisper.
1, 2, 3.
Good job. Okay, now I'm going to have you turn around and come around this side. We're going to inspect her anterior chest. So there again, I'm going to assess for any deformities or symmetry, and also for the use of accessory muscles. So I'm going to assess for chest expansion, and you breathe in and breathe out. Good. Good deal. Now for tactile fremitus, say 99.
99.
99.
99.
99.
99.
All right, and now we're going to listen to those lung fields. All right. Now we're going to assess the heart tones. So we're starting with the aortic on the right sternal border, second intercostal space. I'm going to listen first with my diaphragm, then listen with my bell. So we got the aortic. As I said, it's on the right sternal border, second intercostal space. Pulmonics on the left sternal border, second intercostal space. Erb's point, third intercostal space. Tricuspid, the fourth intercostal space. Mitral valve, which is at the fifth intercostal space. And then we got the point of maximum impulsors at mid-clavicular, mid-axillary. And I'm going to hold that for 1 minute and palpate to get, I'm going to hold this for 1 minute and get the rate and rhythm. And then I'm going to palpate that. Okay, now I'm going to go back and listen with my bell. For the aortic on the right sternal border, second intercostal space. Pulmonic, second intercostal space, left sternal border. Erb's point, third space, third intercostal. Pulmonic, it's the fourth intercostal space, and the mitral, which is the fifth. Okay, now I'm going to ask you to lay down. Do you need a little pillow under your head or something? Okay, so I ask you to lay down. We're going to assess for jugular vein distension. The head of the bed is going to be at 30 to 45 degree angle. So first of all, I'm assessing for any heaves or lifts. I see none. There's no jugular vein distension. I'm going to palpate those auscultation points. The aortics to the right sternal border, second intercostal space. The pulmonics, the second intercostal space on the left sternal border. Erb's points, third intercostal space. Tricuspid is the fourth, and mitral valve is the fifth intercostal space. Now I'm going to listen again those auscultation points with my bell and also my diaphragm. Okay, for the aortic, this is pulmonic, tricuspid, Erb's points on the third intercostal space, tricuspid's fourth intercostal space, and the mitral is on the fifth intercostal space. Now I'm going to move along to our abdomen. When you're assessing the abdomen, you're looking at the contours, symmetry, looking for any obvious deformities or masses. Okay, we're going to, first of all, listen to the aortic, abdominal aorta for any bruits. Okay, and then we're going to listen to the renal arteries, then the iliac arteries, and then the femoral arteries. Okay, good deal. Okay, then also we're going to listen to all four quadrants of her abdomen for bowel sounds, which appear to be active. And then I'm going to percuss her abdomen. We're going to listen for tympany, dullness or flatness. And then I'm going to palpate for any masses. Tenderness, you hurt? Okay, good. Then I'm going to assess for her liver, palpate her liver, and also her spleen. Alright. Good deal. So I'm going to ask you to sit up now. We're going to start with the musculoskeletal part of this exam, which I'm going to be assessing of the joints of her fingers, her wrist, her elbows, and her shoulders. And then I'm going to assess for capillary refill and the radial pulses. Okay, I'm sorry, that was a little sore. Okay, now we're going to assess range of motion in those hands. So I need you to flex, extend, hyperextend, adduct, inversion, and eversion, rotation. Okay, now for the wrist, sorry about that, we're going to flex, extend, hyperextend, inversion, eversion, and circumduction. Alright, now we're going to do for the elbows here. I want you to flex, extend, hyperextend. Okay, with the shoulders, flex, extend, and hyperextend. Okay, now we're going to go with the strengths. I need you to squeeze my fingers for me. Okay, that's a 5 out of 5. Alright, and we're going to assess the strength of her biceps and her triceps. So I want you to flex up for me and extend down. Okay, flex up for me and extend down. Okay, good deal. Now with your shoulders, okay, that's assessing cranial nerve 11 for the use of accessories. So now we're going to assess for deep tendon reflexes in those. So we got the brachioradialis, the biceps, triceps, brachioradialis here, biceps, and then triceps. Okay, and we got patellas down here, patella, Achilles, okay, and Achilles. Oh, she can't see that. Okay. Patellar, Achilles, and Babinski. Okay, now we're going to assess, I'm going to assess the stereognosis and graphesthesia. Alright, so I want you to close your eyes and tell me what you're holding in your left hand.
A paper clip.
Okay, and in your right hand, tell me what you're holding.
A pen.
Okay. Now, keep your eyes closed. I'm going to, for graphesthesia, tell me what I wrote in your hand.
4.
Okay, and in this hand?
A.
Okay, and also I'm going to check for vibratory sensation in her wrist and her medial malleus. Feel that? Okay. Feel that? Okay. Alright. In there. Okay. Good deal. Alright, so now we're going to move on down, do the sensation to your extremities. So I want you to close your eyes and tell me if this is soft or sharp. Alright.
Soft. Sharp.
Okay. Oh, sorry.
That's sharp.
Okay.
Soft.
Alright.
Soft. 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 Soft.
Okay. Alright. So now we're going to assess her feet. Assessing the feet, we're going to also be looking at the toes, the joints of her toes, her ankles, her knees, and her hips. We're assessing for color, temperature, if there's any edema, swelling, or any crepitus or nodules or deformities noted to her joints. So I have to, pardon me, my knee hurts. Okay. Assessing the joints. Okay. Alright, and then I'm going to assess for the dorsalis pedis, Paul says, and the posterior tib. Okay, now we're going to assess the range of motion of your toes. I need you to flex down, extend, hyperextend up, and then abduction, and adduction, inversion, and eversion. Okay, now we're going to do the ankles. I need you to plantar flex down, dorsiflex up, inversion, eversion, and circumduction. Doing this foot too. We're going to do plantar flex down, dorsiflex up, abduct, inversion, eversion, abduct, and adduct, and external rotation. There we go. Okay, now we're going to assess the strengths of her feet. So I need you to plantar flex down, okay, and then dorsiflex up, plantar flex down, dorsiflex up. Okay, those strengths are 5 out of 5. Now I need you to extend out, okay, and flex in. Extend out, flex in. Okay, I need you to abduct out, abduct in. Okay, those strengths are all 5 out of 5. All right, I'm going to ask you at this point to stand up. We're going to assess your hips. Okay, I'm going to palpate the joints. Don't feel any crepitus or anything like that there. All right, I want you to face the camera for me. We're going to do hip flexion and extension. Okay, so we're going to do flex, extend, hyperextend, internal rotation, external rotation, abduction, adduction, and circumduction. All right, with the other leg, we're going to do flex, extend, hyperextend, internal rotation, external rotation, abduction, adduction, and circumduction. Alright, good deal. Now we're going to do our knees. So we're going to flex, extend, hyperextend. Alright, with the other leg, we're going to flex, extend, hyperextend. Alright, good deal. So now I'm going to assess your spine for me. What we're doing is inspecting for scoliosis. I'm going to ask you to flex over. I want to look at the processes in between here, make sure that there's no tenderness, there's no nodules, and that it's symmetry and there's no deformities. So we're going to do a hip flexion here. So you're flexing over. I need you to extend, then hyperextend, and then lateral extend, and then rotate, circumduction your hips. Alright, perfect. Okay, we're going to turn around now, and I'm going to have you walk to that wall. Just go over there. Alright, then I want you to tandemly walk back. Good deal. Okay, stop. Now, with your hands out to your side, I want you to close your eyes. Okay, that's a Romberg test. And then I want you to, we're going to do some exercises here for cerebellum. So I need you to do thumb opposition here, finger opposition, hand flip-flop on your knees. Okay, and then close your eyes, stick your arms out, and touch your fingers to the front of you. Yeah, there you go. Going. And now back out. Open your eyes and do it again. Okay, now hop on your right foot. And then hop on your left foot. Okay, that concludes my head to toe assessment today. Again, today's date is August 22nd, 2022, and the time is approximately 11:52. Thank you.